Have you ever, watched your pet, your dog or cat, just scratching and scratching or biting themselves, licking constantly? It's really hard to see, isn't it?
Oh, absolutely. That nonstop discomfort.
Exactly. And it's incredibly frustrating, not just for them, but for us too, the people trying to help them. So today we're doing a deep dive into pet allergic dermatitis. We've got this huge stack of sources you sent over, articles, research, notes, the whole deal. And our mission really is to cut through all that noise.
Right.
We want to pull out the key stuff, give you, our listener, a really clear idea of what's actually happening with your pet's skin, and, most importantly, how we can help them feel better.
What's truly fascinating here, maybe a bit surprising, is just how common this is, this inflammatory skin condition.
Yeah.
And it's fundamentally driven by the immune system.
Yeah.
It's an over-the-top response to things that are usually perfectly harmless.
The body's kind of attacking itself almost, or attacking harmless things.
Pretty much. The defenses mistake things like pollen or certain food ingredients for major threats, and that triggers skin inflammation dermatitis. That's literally skin inflammation and all the itching and soreness that goes with it.
Okay.
And it's really, really crucial to get this up front. This is something we manage, not cure. That's the key insight for owners. The goal is always ongoing care, being diligent to prevent those flare-ups, and just keep your pet comfortable, maintain their quality of life.
That constant discomfort, it sounds just awful for them. But stepping back a bit, how does their immune system even get into that state, that overactive mode that leads to allergic dermatitis? What are the main things causing it?
That's the core question, definitely. The most common reasons fall into a few main buckets. First, and probably the biggest one, is environmental allergens. This leads to what we call atopic dermatitis.
Atopic dermatitis, okay.
Think about everyday stuff like pollens from trees, grasses, weeds, mold spores floating around, tiny dust mites in our homes, even just general house dust.
Wow.
These little particles, they can be breathed in, or sometimes they're just absorbed right through the skin. Either way, they trigger that chronic itch and inflammation. We see it a lot in dogs, specifically reacting to, say, certain grass pollens, maybe worse in spring or fall.
Okay, so airborne triggers, that makes sense. But sometimes the cause is, much closer to home, right? Like in their food bowl. We should talk about food allergies.
Absolutely. Food allergies are another big piece of the puzzle. This is where the pet's immune system has a specific negative reaction to certain proteins or ingredients in their diet.
Like what kind of proteins?
Often things like beef, chicken, dairy, sometimes soy or certain grains. It's a proper immune response against something they eat regularly.
And that's different from just a sensitivity.
Yeah, slightly different. You also have food sensitivities. Similar idea, but maybe a slower, more chronic reaction. It still affects their skin health, maybe digestion too, but it's not always that full-blown immune system attack we see with a true allergy. Still causes problems though.
Got it. Okay, so environment, food,
right.
What else?
And then there's flea allergy dermatitis, FAD. This one's huge because honestly, even just 1 or 2 flea bites can trigger a massive reaction in a sensitive pet.
Really? Just 1 or 2?
Yes. They're not just itchy from the bite itself. They're allergic to specific proteins in the flea's saliva. You'll often see it really concentrated, typically around the base of the tail, lower back area.
Okay, classic spot.
Less common, but still possible, are contact allergies. That's a reaction to something touching the skin directly. Maybe certain chemicals and cleaners, some types of fabrics, plastics in bowls, or even collars or harnesses. And beyond those direct allergens, we also have to think about secondary factors, things that make it worse.
Like what?
Like a compromised skin barrier. If the skin's natural defenses are weak, allergens get in more easily. Also, underlying health conditions like hypothyroidism can make skin issues worse. And of course, bacterial or fungal infections, sometimes they're the main problem. Other times they jump in because the skin's already inflamed and irritated from the allergy, making everything much, much worse.
Wow. Okay, so it's potentially a lot of things interacting. From the air, the food, fleas, even their own skin health. It sounds like a minefield for pets. Now, we know both dogs and cats get this awful itching, but how they show it, that can be really different, right?
That's a super important distinction, yes. With dogs, it's usually pretty obvious. They're intensely itchy. We sometimes call it the itch that rashes.
The itch that rashes.
You'll see them scratching, chewing at themselves, rubbing against furniture, licking specific spots constantly.
Where usually?
Typically the face, their paws, the ears are very common, the belly, under the legs, the armpits, those sorts of areas.
Okay.
And you see visible changes. Redness, definitely. Hair loss from all that trauma they're inflicting on themselves. Sometimes raw weeping areas, or what people call hot spots. That's technically moist dermatitis.
Right.
You might also notice salivary staining, that reddish-brown discoloration on lighter fur where they've been licking a lot. And if it becomes chronic, long-term, the skin can actually get thicker, leathery almost, and darker.
Yeah.
That's hyperpigmentation. Plus, they're very prone to getting secondary ear infections, otitis externa, because the ear canal is basically skin. Their skin might also get kind of greasy or flaky.
How does this can pop up anytime?
It often starts when they're relatively young, typically between 6 months and maybe 5 years old. And it can be seasonal, flaring up at certain times of the year, or it could be year-round misery for them. I remember one client, their dog was licking its paws nonstop. They thought it was just anxiety.
Yeah.
But nope. Classic sign of atopic dermatitis in that dog's case. Triggered by dust mites, it turned out.
Huh. Okay, so dogs are pretty demonstrative about it. But cats, I hear they can be way more subtle, almost secretive. What should owners look out for that they might otherwise miss?
You're absolutely right. Cats often internalize it more. Instead of frantic scratching, their main sign might be excessive grooming. Licking, licking, licking.
Where do they usually focus?
Often the belly, the insides of their back legs, along their back. This constant licking can lead to areas of thin fur or even complete bald patches. That's alopecia.
Just from licking.
Just from licking. Their tongues are like sandpaper. You might also feel tiny little scabs, especially along the neck and down near the tail base. It feels like little grains of sand under the fur. We call that miliary dermatitis.
Miliary dermatitis.
Okay. Some cats also do something called barbering, where they literally chew or pull their hair out precisely, which, as you can imagine, can lead to more hairballs being vomited up.
Ah, okay, that makes sense.
Other signs can include redness, sometimes oozing spots or crusts, and occasionally these specific angry-looking inflammatory lesions called eosinophilic granuloma complexes. They look like raised bumps or plaques. And sometimes, though less common, you might even see respiratory signs like sneezing, watery eyes, or even asthma-like symptoms linked to the allergies.
Wow. So the big takeaway here for anyone listening is you really have to learn to read your own pet. That subtle over-grooming in your cat could be just as serious as your dog scratching herself raw. Understanding their specific language of itch isn't just interesting, it's critical for catching it early.
Precisely. Connecting that to the bigger picture, recognizing these distinct signs is step one for getting the right veterinary help. If we quickly contrast them, dogs tend towards outward scratching and chewing, mainly face, feet, ears, belly, often leading to hot spots, obvious hair loss, and ear infections. Cats, more inward licking and over-grooming. Common spots are belly, back, behind the legs. Skin issues might be those little scabs or patchy baldness from licking. Secondary problems could be hairballs or even asthma. Sneezing and eye issues are rare in dogs with allergies, but pop up occasionally in cats. Knowing these differences helps vets and owners narrow things down much faster.
Okay, great summary. So we know what it is. We know roughly what it looks like in dogs versus cats. Then comes the detective work. How do vets actually pinpoint allergic dermatitis and figure out the cause? What's that diagnostic journey look like?
Right, the diagnosis.
Yeah.
It is methodical, like detective work. It often starts with those clinical signs we just talked about, plus the pet's history, and maybe seeing if symptoms improve when we try removing a potential trigger. But crucially, before confirming something like atopic dermatitis, we have to rule out other things that look similar.
Like what?
Common skin issues like mange parasitic mites or ringworm, which is a fungal infection. Also, we need to be absolutely sure it's not just flea allergy dermatitis. So that means doing tests like skin scrapings to look for mites under the microscope, maybe a fungal culture for ringworm, and putting the pet on really strict, effective flea control for a period to see if that resolves it.
Okay, rule out the other suspects first.
Exactly. Once those are off the table, then we can move towards allergy testing, especially for environmental triggers. The gold standard is still considered intradermal skin testing.
How does that work?
Basically, a small area of fur is clipped, and tiny amounts of various common allergens, pollens, molds, mites are injected just under the skin. We then watch for reactions, like little hives or bumps, which tells us what the pet is specifically allergic to.
Okay. And is there a blood test too?
Yes, there is. Serum allergy testing. It's a blood test that measures specific antibodies, called IgE antibodies, against various allergens. It can be a practical alternative if skin testing isn't possible for some reason, or sometimes it's used alongside skin testing. It measures the immune system's flags for particular allergens.
Okay, so tests for environmental stuff. Now, Food allergies. I hear that's where it gets, well, a bit tricky diagnostically. What's the challenge there?
Yeah, you're right. Food allergies are a completely different beast when it comes to diagnosis. The frustrating part is, unlike with environmental allergies, there aren't currently any reliable, accurate skin tests or blood tests for food allergies in pets.
Really? No tests. So how do you figure it out then?
It relies entirely on doing a strict elimination diet. We often call it a food trial.
Okay, what does that involve?
It means feeding your pet a very specific diet for usually 8 to 12 weeks. Critically, this diet must contain only ingredients your pet has never been exposed to before, usually a single novel protein source like venison or rabbit and the novel carbohydrate, or alternatively, a prescription hydrolyzed protein diet.
Hydrolyze.
Yeah, where the proteins are broken down into such tiny pieces that the immune system ideally doesn't recognize them as allergens. During this trial, the pet eats only this special food. No treats, no table scraps, nothing else.
Wow, that sounds tough.
It requires serious dedication from the owner, but you watch carefully for improvement in the skin symptoms. If the itching and inflammation get significantly better on the trial diet, then the next step is the challenge, reintroducing the old food. If the symptoms flare back up, bingo, you've confirmed a food allergy. It's painstaking, but often the only definitive way.
Okay, diagnosis done. We know what we're dealing with. Now the battle plan. What do we actually do? Remembering what you said earlier, it's about management, not a magic cure. What are the main strategies?
Exactly. Management is the name of the game. And one of the most effective long-term approaches, especially for environmental allergies, is immunotherapy. Allergy shots or oral drops.
Immunotherapy. How does that work?
What's fascinating here is how it tries to retrain the immune system. You're giving the pet tiny, gradually increasing doses of the specific things they're allergic to. The idea is to desensitize their system over time, teaching it to tolerate those allergens instead of overreacting.
So it calms the immune response down.
Precisely. It often leads to a significant reduction in symptoms, less itching, fewer flare-ups, and sometimes even long-lasting remission. It's a long-term commitment, though.
How long?
You usually don't see major improvements for several months, maybe 6 to 9 months, sometimes longer. But the benefits can last for years, making it a really sustainable, lifelong option for many pets. I often frame it to clients as a marathon, not a sprint.
Okay. Are there downsides, besides taking a while?
Well, the upfront cost can be higher than just starting medications, and it does take that time to kick in. But over the long haul, if it reduces the need for constant medications, especially ones with potential side effects, it can actually be quite cost-effective and better for the pet's overall health.
Right. So while that immunotherapy is maybe getting started, or for those sudden awful flare-ups, what about medications for more immediate relief?
Yeah, absolutely need those sometimes. They provide comfort much faster. But we always have to be mindful of potential side effects with long-term use.
Okay, like what?
Well, for localized spots, like maybe red skin in the groin or armpits, an over-the-counter 1% hydrocortisone cream can help. It's a topical steroid, so it's generally safer than giving steroids by mouth because it mostly just acts on that specific area.
How do you use it?
Just apply a thin layer to the inflamed skin, maybe twice a day. It absorbs pretty quickly, usually within 10 minutes or so. You just want to try and distract your pet so they don't immediately lick it all off.
Okay, what about pills, like antihistamines?
Yep, OTC antihistamines are another option. Something like Benadryl, the generic is diphenhydramine, that's an older one people often try. The dose is usually around 1 milligram per pound of body weight, maybe 2 or 3 times a day.
Does it work well?
It can help some pets, but honestly, its effectiveness for allergic itch in dogs and cats is, well, it's variable. And it can cause side effects like drowsiness or sometimes paradoxically agitation. Also potentially some GI upset.
Are there newer ones?
Yes, there are newer generation antihistamines like cetirizine, which is the active ingredient in Zyrtec. It tends to cause less sedation or agitation. The dose is typically lower, around 0.5 milligrams per pound, maybe once a day or split into twice daily. It works by blocking histamine release.
So maybe fewer side effects with cetirizine?
Generally, yes, fewer significant side effects. Choosing between them, or if they'll work at all, often depends on the individual pet. It's always best to chat with your vet before starting any new medication, even OTC ones.
Good advice.
Yeah.
What about stronger stuff?
For really severe,
Okay. Any other treatments?
medicated baths can be really helpful too. Using specific shampoos can soothe irritated skin, wash off surface allergens like pollen, reduce inflammation, and treat secondary skin infections if they're present. And speaking of infections, if there's a deeper bacterial infection in the skin, a course of antibiotics will likely be needed as well.
Gotcha. So lots of tools in the conventional vet toolbox, but here's where it gets really interesting based on the sources. There seem to be some natural plant-based options that might offer pretty fast relief too. Tell us about those.
Yes, it's a really exciting area, and some of these have good evidence behind them. They can be incredibly useful, often with a better safety profile for long-term support. Take quercetin, for example.
Quercetin, where does that come from?
It's a natural compound, a bioflavonoid found in things like red onions and apple peels. It acts as a natural antihistamine, helping to stabilize the cells that release histamine. And it's also a potent anti-inflammatory, so it directly reduces skin inflammation and redness.
And it works fast.
Anecdotally, many owners report seeing improvement pretty quickly after starting it. And the great thing is, it's generally considered very safe for long-term use. A typical starting dose might be around 50 milligrams per 15 pounds of body weight once a day, potentially increasing to twice daily if needed.
Interesting. What else?
Then there's licorice root extract. The active compound is glyceric acid. It has strong anti-inflammatory effects, actually quite similar in mechanism to corticosteroids.
Wow, like a natural steroid?
In a way, yes. It works quickly to interrupt that inflammatory cascade in the skin, which can markedly decrease inflammation and itch. However, because it has steroid-like effects, it's generally recommended for short-term use.
How short-term?
Maybe for a flare-up, use it for 2 or 3 days, up to a maximum of maybe 14 days on, then take a break for 7 days. Then you could potentially do another 14 days if needed. Typical tincture doses are around half a milliliter per 20 pounds of body weight twice a day, but definitely one to use cautiously and ideally under guidance.
Okay, good to know. One more.
Beta-sitosterol. This is a type of plant sterol found in various plant seeds, commonly extracted from soy or found in flaxseed. It has really impressive anti-inflammatory and what we call anti-atopic properties. It seems to help modulate that whole itch-scratch cycle and directly decrease skin inflammation.
Is it safe? Does it work quickly?
It's considered very safe, with minimal to no side effects reported. And yes, it can work fairly quickly for some pets. A common dog dosage is around 2 milligrams per pound, once or twice daily. It's often found naturally bound in oils like flaxseed oil, which is a bonus because flaxseed oil also provides beneficial omega-3 fatty acids, which are also good for skin health.
That's fantastic. And I feel like these plant-based options aren't just alternatives anymore, but potentially powerful, fast-acting tools.
They really can be. They offer ways to potentially reduce reliance on long-term pharmaceuticals and give owners more options, especially for managing those frustrating flare-ups.
Okay, so adding those natural options to immunotherapy, medications, baths, it all builds up this picture of a multi-pronged approach, which sounds like the key, really. Beyond these specific treatments, what are the other absolutely essential parts of the overall management plan?
Absolutely essential, yes. You need consistent year-round effective flea control. Even if you don't see fleas, especially if flea allergy dermatitis is even a remote possibility. We're talking about reliable prescription products, often ectoparasiticides, that kill fleas quickly.
Non-negotiable, basically.
Pretty much. Then, if food allergies are suspected or confirmed, sticking strictly to that prescribed hypoallergenic or novel protein diet is critical. No cheating.
Right. The diet trial discipline continues.
Exactly. And finally, environmental management. Once you know what environmental triggers are involved, doing your best to minimize exposure is key. That might mean more frequent vacuuming and washing of bedding to reduce dust mites, using air purifiers, avoiding walks in grassy fields during high pollen season, wiping paws after coming inside. Whatever makes sense for the specific triggers. This raises an important point. It really highlights just how complex and multifaceted pet allergic dermatitis is. There's rarely one single solution. It truly demands a holistic approach, looking at everything from the environment to diet to infections to specific treatments.
Yeah.
And the core message really is that it requires persistent management. Often it means making real lifestyle adjustments for the long haul, but that commitment is what ultimately maintains the pet's comfort and their health.
So what does this all mean for you listening right now? Hopefully understanding these causes, the different ways pets show symptoms, and this whole toolbox of management options from immunotherapy to quercetin empowers you. It gives you the knowledge to be a truly proactive partner with your vet in managing your pet's health. Maybe take a moment and consider, how might even small, consistent changes in your pet's world, their diet, your cleaning routine, a new supplement, how could that dramatically impact their comfort? Could it turn that constant irritation they feel into just peaceful rest? Knowing what you know now, what might you notice differently about your pet today? What's one small change you could try?
It's worth thinking about.
Definitely. That's all the time we have for this deep dive. Thanks for joining us, and we hope you'll tune in next time as we unpack another fascinating topic.